ACL injuries are the tearing of the ligament that connects the thigh bone to the shin. They're growing rapidly, and female athletes are more likely to sprain or tear their ACL. I sat down with HCA orthopedic surgeon Dr. Daggett about this phenomenon. Dr. Daggett, as a former athlete and a workout enthusiast, I was shocked to learn that women are more likely to suffer from an ACL injury than men.
Yeah, it's true, and it's really unfortunate, and more women are playing sports now more than ever. And so we're seeing, unfortunately, really an epidemic in ACL injuries throughout the nation and locally as well. I played sports in high school as well as my wife, and unfortunately she tore both her ACLs, and I was fortunate enough not to have the same fate. And there's a lot of reasons for that. One is the increased amount of sports that females are playing, but there's also some just physiologic difference between men and women that really account for some of those differences.
How can we look for this, whether we're a girl, woman, parent, coach, or a weekend warrior? What signs should we look for if our ACL has been hurt?
Yeah, the classic symptom of that is really a non-contact injury where it almost doesn't seem like that violent type of injury, but it's a non-contact injury where you're just making a twist or a move to a different direction. You feel a pop, you have a lot of swelling, pain, and ACL injuries are kind of different in everyone. They're very individualized because you have a lot of different injuries that can occur when an ACL occurs. Some patients can walk right away without significant pain, and others it's really hard to get off the court or the field.
What are other ways that maybe somebody could still play sports or still go on with their daily activities if they have suffered this?
Yeah, the hard part with an ACL is it's a primary stabilizer of the knee. And if you have an injury to the knee, oftentimes you're unable to continue with pivoting and cutting maneuvers because it's so essential for that knee function. So really the biggest thing we can do is really try to prevent ACL injuries from happening. Unfortunately, there's not as much literature or evidence that we would like for ACL injury prevention. A lot of focus is actually focused on the treatment side. How do we better treat these, which is really something we need to focus more on, is how do we prevent them from occurring in the first place.
And what are some of the risk factors that girls or women face?
Women have a lot of risk factors that males don't have. Most of them deal with just the way our bodies are created from a male versus female way. Females typically have a wider pelvis that puts a little more pressure on the knees themselves when they suffer for those rotational injuries. Another interesting thing is there are some knee anatomical differences. There's a ligament on the outside of the knee that supports the ACL, and we performed a study which we found that ligament was half the size, the thickness in females as in males. Yet another contributing factor to that. There's other things like hormone levels and differences between males and females and landing mechanics that are pretty typically found in the gender differences. And all those things really kind of provide a multifactorial reason for that difference.
Such great information from Dr. Daggett. To learn more about sports-related injuries and to find a physician, head to MidwestSportsCare.com.